most famous physical therapist on the internet.
Hi folks, I'm Bob Shaw, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to show you the 5 stretches you should do for kneecap pain or patellofemoral pain syndrome. If you haven't done so already, you may want to watch our video on what is causing your knee pain, patellofemoral pain syndrome or kneecap pain.
That's all part of the
how
title.
To tell. Yeah, how to tell. Because it'll help you with this one, maybe understand a little bit why we're having you do these things. So let's get right to it, Brad. These are 5 stretches, and you know, there's other things you can do for this type of knee pain, and we'll talk about that in another video. But these are the stretches you should do. So the 5 stretches, the first one is the hamstring stretch. Now you can do, boy, my voice cracked.
You're supposed to be going through that crackly voice stuff when you're a teenager.
Yeah, I know. So, they're 61.
Oh, sorry.
I'm almost 61.
Oh, that doesn't count.
I'm stretching the hamstring.
Yep.
So you can actually use one stretch out strap, which we have, or you can actually do it, just bring the leg up and pull back like this. It's a good way to stretch it.
If you're very able, active, and steady on your feet, you can do a hamstring stretch like this.
But keep good posture.
Yep, straight back, don't round over. We want to just stretch the hamstrings, and it makes a significant difference when you do it this way. You can isolate those muscles better.
Remind me, Brad, at the end of the video, we're going to show them the massage gun because
the
massage gun does a great job with these muscles. To me, it's really superior.
Right.
It's just stretching.
It makes life easier, and it feels better, too.
Right. So, 3 times 30 seconds for the hamstring.
Yep.
And then we're going to do the iliotibial band. So that's the band that runs all the way from by the hip all the way down and crosses the knee.
Right.
So we want to make sure that's nice and loose, or, well, we can't really loosen the band, but it might be adhesed down a little bit, or we can surely stretch a tensor fascia lata.
My name's Brad, not Shirley. Yeah, so we're going to show them that stretch.
Yeah, which one do you want to show?
For the TFL?
Yeah.
Tensor, okay.
Yeah, which one do you want to do?
There's only one TFL, one on each side, right?
Well, you can do this one.
Oh, I see, the figure 4, sure.
Right, and pull up like that.
I like that one myself.
I do too.
It gets the hip really well as well.
You can do the one against the wall. Do you know that one?
Sure. We'll get Sam out of the way. Yeah, the one up against the wall is nice because you don't have to lay down. It's very, just find a wall. I'm going to stretch this one right here.
Right.
So I like to cross my leg over. And
Same with me.
Let this hip drop in. And, you feel a stretch there. Like Bob was referring to, I've always, as a therapist, thought, this is a really hard tissue to stretch because that tendon is very
thick and
it's
collagenous.
You can stretch the muscle up here. That's going to stretch. But is that band actually going to stretch? There's controversy over that, and I think more now so than
no, I don't think you can stretch it, but it can be adhesed down to the body or the fascia, and that's where a massage gun would help.
Yeah,
I think because you can stretch it all day long and you're not going to make any changes in that band.
Yeah.
So, all right, next one, quadricep stretch. This is just a simple way of doing it. You can actually pull back like this and
you could do that on a chair where, if you have armrests that kind of get in the way because you need to turn sideways on the chair.
You can go like this.
Yeah.
And you can actually get a band, or a stretch out strap and pull on like that.
You can use a belt and put it around your ankle. You could just stand up if you're pretty fit and able and not at risk for fall, and do this. But make sure you're upright, tall with posture. Bring the knee back, and that'll really get at those quads. You'll feel it clearly.
Yeah. And then we want to do a calf stretch. You want to just show the go, I guess.
Yeah, the old go-to easy. Grab a wall, and we're looking at this one right here. The one in front is just there, not getting stretched. Make sure your toe is pointed towards the wall, knee straight. Stretch and hold, and then knee bent, stretch and hold, so you get the soleus and the gastrocnemius muscle. And it's nice to hold those for longer periods of time, 15 to 30 seconds.
Yeah, if the calf muscle is really tight, your foot might react by pronating more or flattening more. And when your foot flattens, that puts the knee at at more of a knock-kneed,
Yep.
and that puts more stress on the patellofemoral pain
Right.
syndrome. So,
Not good.
yeah. So the final one is actually going to stretch the kneecap itself. And now you're not going to do this if the ligaments, if you're really loose ligamented
Like-
or hypermobile.
Some people say double jointed.
Yeah, like if you can take your hand and put it down to your wrist,
Yep.
you know, or
the
your
the
thumb.
test, the
Yeah, your thumb.
touches there.
Yeah, or your elbow almost bends the other way.
Yep. If you go back like this, and your knee actually bends a little bit the other direction, hyperextension.
Yeah. Generally, you know it if you
Yeah,
have loose
most
ligaments.
people-
So what I don't want you to do is push the kneecap around and make it dislocate,
Right.
which is unlikely, but it could happen on someone who is very, very loose. So you're going to make sure the quadricep is nice and relaxed.
Yep.
Because if it's tight, you're not going to be able to move that kneecap around. But quite often, in people who have patellofemoral pain syndrome, they are tight in one direction of the kneecap, or possibly in all directions.
Sure.
So probably one of the most common directions where it's tight is when you push it this way.
Yep.
In fact, Brad mentioned in the last video, that's why they often have a surgery where they actually release the tissues on this side so that the kneecap can travel back to where it should be in that groove.
I believe they call it a lateral release.
Yep.
Mhm.
And you can move up and down the kneecap. This is the easy one to do. You can do while you're sitting in school or
Yep.
sitting at work. And
You pretty much got to put your leg out straight. You can't do it with a bent knee at all.
Right.
The knee has to be. This actually looks really good on a ball, but you know you could put a chair in front of your
Sure.
or ottoman or whatever
or
is available.
if you can reach down like this,
Yep.
just keeping the leg straight.
Yep.
So let's show the massage gun now, Brad.
Oh
Let's-
yeah.
I'm going to grab the monster.
All
So
right.
this is for athletes. This is the Bob and Brad massage gun. I'm sorry to give it a plug, but we have very high standards.
Yeah, they're nice guns,
These
and
are
they're
nice
they're
guns.
good price, and we're very
Yeah,
happy with them.
Very happy with them. So this baby, it's got this metal head, and this baby will penetrate. So if you want to work that IT band, and there's any adhesions on that, you'll work through it.
All right, but don't get Bob wrong. You don't have to beat
No.
the hell out of your legs to do this, make them sore. You know, if you're got a lot of muscle, you know, and you're just a guy that wants to.
Well, a lot of times, I mean, to be honest, Brad, if you are a more muscular guy with big legs and stuff,
Yeah,
you do need something like this.
That's
I
true,
mean,
yeah.
you're going to want to.
If you're an average or you know older person or a thin person, I like this round head because then this is pretty aggressive, but you can just change how aggressive by changing the angle, which is pretty handy. Are we going to talk about if you get by the kneecap?
Sure.
Then, because these come with 5 heads, and this head works really good when you come close to a bone and you want to get those tendons where they connect to the bone. It's cushion, it's an air cushion, and boy, you know these pop on and off extremely easy. Little interference fit there, and we'll get that one going here.
And that's the thing. This thing you can actually pretty much use anywhere because you
Right.
can go right over the bone. It won't hurt.
Yeah, I was using this one this morning on my pec muscle. That's the thing. If you do have a massage gun, you're going to find you use it on every part of your body.
Well, especially when you start getting up in the later years.
Well, yeah, if you're really active and you're straining muscles all the time,
Yeah.
or you're a little older and you're straining things all the time.
Well, I think it's great prior to an athletic
Yep.
event. It's better than stretching in my
Yeah.
mind. Way better.
Well, I like to do it, and then I'll stretch right afterwards.
Sure.
Kind of like a heat gun, but it just feels good.
I use it every morning before I run.
Oh, you do?
On my
On
calves.
your calves, yeah.
Yep. So there we go. By the way, this video is a part
Oh,
of a series of videos on knee pain. If you want to see the entire series, go to bobandbrad.com, bobandbrad.com, and go to the program section, and you'll find we have a number of programs there on sciatica
Yep.
and hip pain and stuff. But we have one on knee pain. You look at it, we'll have like 30 videos, and you can watch the ones that pertain to you.
Yeah, you don't have to watch all of them. There's a big bonus. There's a PDF printout, has a review. You can print it out of the exercises and with the information on the video. There's no charge for this, not even your email. If by chance it says not up yet, it means because we're still downloading the PDFs and everything for it. And you have to
Uploading, right?
upload. Oh, sorry. Yeah,
yeah,
download,
uploading.
They're still coming in from
Right.
wherever. So, anyways, be patient and come back and check it out later.
Yep. Thanks for watching.